Hi, my name's Taylor, and I did my project on sexually transmitted infections. The STI epidemic. STIs are the most commonly reported infectious diseases in the United States. In 2016, STIs represented 4 out of 6 most frequently reported diseases, and 20 million new STI cases occur each year. By age 25, half of young people will acquire an STI. Most often, STIs are asymptomatic, so they may go untreated and unnoticed, which contributes to the rapid contraction and spread of STIs. A fourth of sexually active adolescent females have an STI. Who is affected? Anyone can get an STI, but some population groups are more greatly affected. Women. The consequences of STIs are more serious in women than men. STIs are more likely to be transmitted from a man to a woman. There is a biological sexism towards women in regards to STIs, meaning they are more likely to get STIs than males. Studies have found that women who had sex with both men and women had greater odds of acquiring a bacterial STI. Who is affected? Age disparities. Sexually active individuals between the ages of 15 and 24 are at higher risks for STIs than older adults. Half of new STI cases are among those aged 15 to 24. Young people are at greater risk because they are more likely to have multiple partners, are more likely to engage in risky behaviors, select higher risk partners, and are more likely to face barriers to accessing quality STI prevention products and services. Racial and ethnic disparities. Health status, poverty, access to quality healthcare seeking behavior, illegal drug use, and communities with high prevalence of STIs contribute to STI risk. And here I have included a graph of different races and ethnicities and their rates of STIs. The most common STIs in the United States are chlamydia, gonorrhea, syphilis, urethritis, and HPV. Chlamydia is the most common bacterial STI and the most commonly reported infectious disease in the United States. The highest rates of reported chlamydia in 2016 were among Black, American Indian, and Native Hawaiian and Pacific Islander women. By age 30, 50% of sexually experienced women have had chlamydia. Women who have had chlamydia 3 or more times have a 75% chance of becoming infertile. It can be transmitted during unprotected vaginal, anal, and oral sex. Chlamydia is known as the silent disease, and in women, they are typically asymptomatic, but can have abnormal discharge and painful urination. And about half of men are asymptomatic, while others may have discharge from the penis, burning or itching, and persistent low fever. If left untreated, chlamydia can lead to pelvic inflammatory disease and can be treated with antibiotics. Gonorrhea is the second most commonly reported notifiable disease in the United States. It is transmitted through sexual contact with the penis, mouth, or anus of an infected individual. Women are mostly asymptomatic, and with men, many are asymptomatic but may experience itching, burning, or pain with urination and discharge from the penis. It is also considered a bacterial infection. People with gonorrhea can more easily contract HIV, and gonorrhea can be treated with antibiotics, but some strains are drug resistant. Untreated gonorrhea can cause sterility in both sexes, ectopic pregnancy, prostate damage, epididymitis, scarring of the urethra in men, and testicular pain. Syphilis is a genital ulcerative disease, and it can spread through the contact with toilets, doorknobs, swimming pools, hot tubs, bathtubs, shared clothing, and eating utensils. Untreated syphilis in adults can lead to brain damage, heart disease, blindness, and death. And it is known as a great pretender because many of its signs and symptoms are indistinguishable from others, and it is also considered a bacterial infection. There are 3 stages of syphilis. The primary stage, in which an individual would see a small red pea-sized bump, which will appear and it'll be painless, which is otherwise known as a canker. And 6 weeks after the canker has disappeared, a rash may appear along with swollen lymph nodes, fever, headaches, fatigue, and muscle aches. In a latency stage, the individual may have no more symptoms but is still a carrier for syphilis. Syphilis is easily cured and can be treated with antibiotics, but if left untreated, it may lead to internal organ damage. Urethritis. Urethritis is otherwise known as a urinary tract infection, and it is the inflammation of the urethra, and it results from sexual exposure and non-infectious conditions. Chlamydia can cause urinary tract infections, and they're sometimes called NGU. Women are likely to be asymptomatic, but if symptoms are present, they may include painful urination and itchiness. Men may experience a burning sensation when urinating and may have white or yellowish discharge. If left untreated, urethritis may result in permanent damage to the reproductive organs, and antibiotics are typically effective in the treatment of UTIs. HPV, or human papillomavirus. HPV describes a group of viruses of 100 different strains. HPV is so common that nearly all sexually active men and women get it at some point in their lives, and most people who have genital HPV do not know that they are infected. Certain types of HPV can cause genital warts in both men and women. In 90% of the cases, our body's immune system clears the HPV infection within 2 years. And 1/4 and 1/5 of men and women have a high risk strain of HPV that can cause cancer of the cervix, vulva, vagina, penis, anus, or throat. The Pap test is the most common test to identify abnormal or precancerous tissue in the cervix. Additionally, HPV vaccines do exist and prevent infection with HPV types that cause genital herpes. Some facts about STIs are that 58% of women say they rarely or never use condoms. 15% of infertile women are infertile because of the damage of an untreated STD. And 50% of sexually active young people will get an STI by the age of 25. And here are my references.